Welcome back, and now I have the great pleasure of introducing someone who's becoming a good friend of mine as well as a powerhouse businesswoman, Melinda Montiverdi. How are you?
Good, thank you. How are you?
Good. I love your last name. I love just sort of putting that little pomp and circumstance on that.
Thank you.
Great. So you are the CEO of HomeStaff MA, Massachusetts, right?
That's right.
Great. Now tell us a little bit about HomeStaff.
HomeStaff is a private duty company that has been around for 37 years. We're owned and run by Fallon Community Health Plan as well as VNA Care Network. They're 50-50 owners, and we provide all kinds of services: caregiving, companion, home health aides, CNAs, any kind of service needed in the home so that we can keep people at home versus going into other situations.
That's great, and with the population of the baby boomers aging and now getting into the senior, I'm sure that a need for your services is even greater. But even beyond that, in my experience, that with my mom and my dad passed but my mom, and also bringing up children, the sandwich generation really needs someone like you, because we're torn on making decisions for our loved ones. Do we put them in a nursing home? Do we try to keep them at home as long as we can? And so your services help us keep our loved ones at home.
Absolutely. We provide any kind of services needed to keep any age at home. You know, anybody who needs services, whether it's a medication prefill or personal care or companionship, respite care, any of those things. We provide 24/7. We provide awake at night services. So if a family needs to sleep at night and has a family member who has dementia or Alzheimer's, we have caregivers who are specifically trained to work with that type of client as well. So somebody with Alzheimer's or dementia, we have caregivers who we've done very special training with them so that they know how to approach them and the right way to deal with them in the most compassionate and caring way.
Well, I've had the experience, again, I like to say that I am one of all our 500,000 viewers, that we have this experience with our loved ones. But let's say someone is just encountering an issue with their loved one, either their spouse or their parent. So what do they do? Just call you up?
Absolutely. What they do is they just give us a call, and we can refer them for any services needed. We also, being parented by the VNA Care Network as well as Fallon Community Health Plan, there are multiple other services out there within our group of care members. So Fallon Community Health Plan has the Summit organization, and they provide a very special type of service to the community. They provide kind of like for lack of a better term, one-stop shopping. Physicians, doctors, nurses, all in one building to be able to care for people and keep them home longer. They allow people to come into their day program and spend the day while their family members can work and have a break as well. So Fallon provides Summit and also Navicare, which are people who really are home. And they're providing increased services at home to try to allow them to stay there and not.
So this is Navicare is more like, let's say one day when we're going to be seniors, which will never ever happen.
Never.
But let's
Never.
say we're on our own.
Right.
So Navicare, I could come to you, or someone can come to you and say, look, I'm at home and I just need a little augmented help. And so what kind of services would you provide?
Well, through Navicare or Summit, it's going to depend on the needs of the client. So they do special assessments on the needs of the client and what services are provided. And then the VNA Care Network for acute needs is also available to provide PT, OT, and nursing in the home care setting. And the nice transition is because Fallon and the VNA own HomeStaff, then the private duty piece comes into play as well. So it's really great continuity between companies who work together.
That's great. And you're knowledgeable because you are an RN.
Absolutely.
Right? For how many years?
Over 20.
Wow.
20
So
years.
What were you, about 15 when you got the
I was really 4.
Oh, geez, sorry, I overrode that one. But so, and then also you're getting your master's?
I am. I'm a graduate, hopefully, of Worcester State University in about 12 months. So
oh, that's
I'll
great.
have
That's
my master's.
wonderful.
Yes.
Now, you said that there's some regulations occurring, and so why don't you tell us, just maybe end our segment with some of the regulations we should be aware of. Our viewers like to be in the know.
Well, there's an Accountable Care Act that's out there now, and what they're doing is they are really trying to prevent rehospitalizations for clients or patients in the community. What they're trying to do is hold hospitals accountable, hold physicians accountable, hold home care agencies accountable for the care that they're giving and the discharge planning that goes into that care. So when patients are discharged, there's a much more I guess, advocacy type of role going on now that we've never seen in the past.
My experience has been that my father was in the hospital, they took care of the issue. If it was an infection, then they signed him out, and then it was like...
It's very different than that now.
Oh, thank God.
What they're doing is they have discharge planners who are assessing the person from the moment they enter the hospital. They're following them through their hospital stay. They're making calls. It depends on the actual hospital, but they're joining together physicians' offices with hospitals, with home care agencies, and like elder service agencies.
Sure.
All of those agencies are joining together to prevent hospitalizations, and if they're not prevented and somebody is readmitted with the same diagnosis, there's a financial issue that occurs at that point. So
that's great. I'm so happy you shared that that new legislature or new regulation.
Yeah, right, it is a new regulation.
That is great. It's great to have a friend like you who's knowledgeable in the area. Sure. Especially dealing with seniors. Well, thank you so much for coming on the show. Thank you for enlightening our viewers, enlightening me as well, because it's so changing so quickly.
It is.
That sometimes we don't even know how to keep up with it. We don't know what's out there, but the services are really out there. I know that I've had my parents, fantastic services out there to help care, and thanks for an organization like that, like yours.
You're welcome. Thank you for having us.
Great, and we'll see you around.
Thank you.
Thank you. And we'll be right back.